Okay, start with the saying. I don't know who wrote this, but I really like it. When I joined MBBS, I thought of saving many lives. Now I think of saving only one life. I'll not say only one life, but first my own life. And then I start thinking of saving anyone else's life. This is by an anonymous Indian doctor. So true that we need to understand that it is always save your life first. It is not worth losing your life for anyone else because you have a family and they are always waiting for you. They depend on you. Some of the bitter truths. Malpractice does occur and that patients are injured or die as a result. There's no data from India. The problem of generating data from India is that if you would generate a data, that could itself lead to a lawsuit. The legal system is not mature enough to handle human errors as errors. They are considered as more negligence. But in US hospitals causes around 44 to 98,000 deaths of patients per year. Also, let us realize in India, the reverse is also true. Most patients who are injured as a result of negligence do not sue in this country. And in our hearts, we always know where we have faltered, and the patients would never know about it. But many patients who sue are not injured as a result of negligence. They sue for the heck of suing it, or someone has really instigated them to sue, or there could be some other reasons for suing doctors, not necessarily their belief in negligence. So there are many laws applicable to medical services. The medical services are not exempt from, in fact, all the general laws, which include the Indian Penal Code, which is the criminal law system. Currently under consideration is the Bharat Nyaya Sanhita, as we call it, the IPC. The Indian Contracts Act, the civil liability arises because medical services are provided for a payment, and this is a sort of contract. May not necessarily be a written contract, but an oral contract is as good as a written contract as long as the person can prove there is an oral contract. And anyone coming to a private hospital and getting treatment actually gets into a contract with the hospital or with the doctor that I'm going to pay you and you are going to treat me. So under the Indian contracts law. Law of torts is a civil liability. That is, if we infringe on someone's rights and the person gets injured, then we are liable to pay for it. And then there are specific legislations like the MCI Act of the yesteryears and the NMC Act of today. Now, then why, if there are so many laws which can protect a person, or a consumer or a patient, what is the need for a Consumer Protection Act? We all know then the famous dialogue from Damini, Tariq pe Tariq pe Tariq. The justice was time consuming. So we all know that as normal court, it can take years to pass a judgment at one level, and then you go to the next level and the next level and the next level. And this could be that the justice comes in the next generation or the generation afterwards. So justice is time consuming in this country. Justice is expensive. To go to a common court, the expenses of the lawyers, the court fees, everything is expensive. And for a common man, it is not possible to really have that much of money to spend on a litigation. The civil and criminal courts work on different parameters. I'm just differentiating the two. Criminal courts, the works on beyond reasonable doubt. That means someone has to prove that an act has been done with beyond reasonable doubt. Whereas civil courts work on laws of probability, that yes, the balance of probabilities, that this is likely to be true and this is likely to be false. But in civil courts or criminal courts, it's very difficult to prove negligence and causation. And lastly, if we go to the Indian Medical Council or the NMC Act, there is no provision toward compensation to patients who are injured as a result. They might suspend or even revoke the license of a doctor, but that is the maximum punishment that can be awarded under the Indian Medical Council Act or the NMC. So they were not necessarily, they do not necessarily a consumer-oriented acts. So the government thought of providing a Consumer Protection Act. I'll not go to the old act, but the new act which came in 2019, the objective of the act is to provide protection to the interest of the consumers. I'll define a consumer as we go. And for that purpose, this objective, the way to do that is to establish authorities for timely and effective administration and settlement of consumer disputes. Realize this Consumer Protection Act is not only applicable to medicine, it is applicable to all goods and services that come under the Consumer Protection Act. Now, this is important. Who is the consumer? Any person who hires or avails of any services. So even if you hire, you say, you are going to operate on me on that particular day, and you don't do that, the person, you were hired for it. So he becomes a consumer even if you have not done a surgery for the patient on a particular day, or the surgery was done, avails of the service, which has been paid or promised. Now, the patient pays for it, that is fine. But even if the patient promises to pay and does not pay, he still becomes a consumer. So if a patient has come to your hospital, got treatment, did not pay anything, he still is a consumer. It is not that he cannot file a case in a consumer court because he promised to pay. And also, there could be surrogate people who hire services. In pediatrics, it's almost always the parents who hire or avail the services of the doctor of the hospital. So you can have someone else also as a beneficiary of the services. Who can file a complaint? The consumer can file a complaint, obviously, but in pediatrics, it is usually consumer being a minor, his parent or legal guardian. In case of death of a consumer, a legal heir or a legal representative. So we need to understand these are some of the basics of Consumer Protection Act. Coming to levels, now there has been a major change in the Consumer Protection Act as far as this is concerned. The pecuniary jurisdiction, pecuniary means the monetary jurisdiction of various levels of consumer redressal commissions. Now, in the past, the pecuniary jurisdiction was on what the patient demands or the consumer demands. Consumer says, I have been injured and I have been mentally harassed and I want 1 CR. Now that would take it to the National Commission. Whereas the new Consumer Protection Act, it is the values of the goods and services paid as consideration. That means agar patient ka bill, if the patient's bill is 50 lakhs, a patient has to necessarily go to the District Consumer Disputes Redressal Commission. Whatever he may ask as a compensation, that does not really count. Whereas earlier, the compensation asked could really push up, and that was one way of harassing doctors that, or for that matter, anyone, is that take the case straight away to the National Forum by asking too much of money. Whether that is deserved or not does not really matter. So the levels are District Consumer Disputes Redressal Commission. If the value of the goods does not exceed ₹1 CR, state between 1 to 10 CR, and national consumer between 1 or more than 10 CR. Again, this is major change again in the Consumer Act. Where the case can be filed, obviously where the act has happened. If you are working in Ludhiana, I'm working in Ludhiana, and the hospital is in Ludhiana, and the so-called negligence occurred in my hospital, the case can be filed in Ludhiana. Or where the opposite parties or any of the opposite parties normally resides or works. Like I work in Ludhiana, but if I live in Jalandhar, so the case can be filed in Jalandhar or Delhi or Chandigarh, wherever. But the worst part of the new law is where the complainant resides or personally works for gain. So a person coming from Tamil Nadu, coming to my hospital, visiting Ludhiana for a day or two, gets a child sick, gets treatment at my hospital, is not satisfied, can file a case in Tamil Nadu. Now, that is worrisome. That should be worrisome for the people who have to respond to that complaint, because then now you need to go all the way there, hire a lawyer there, and then perhaps appear in at least some of the hearings. You can't go to all hearings, which is ideal that you should go for all hearings. So the complainant can file the case at the place where he normally resides or personally works. So what is the liability under the consumer? Who all are liable? So obviously all medical practitioners who are doing independent medical practice, but not rendering only free service. If you are doing only free service, then you are not liable. But if you are doing any paid service, then you are liable. Private hospitals, definitely. But more importantly, we need to understand all hospitals having free as well as paying patients. Even the patients who receive services free of cost are treated as consumers. And this is by a ruling of the Supreme Court, which said that even free patients in hospitals where some of the patients are paying are consumers. And perhaps this was for a government hospital. If I'm right, it happened in PGI, that because there are some paid beds, there are private rooms. So because there are private rooms and there are paying patients, the patients who are treated free of all of them become consumers. And lastly, even if the money is being paid by an insurance company or an employer, still the person who avails of the services is a consumer. I would be happy if people can just put in questions during the talk also, and I'll try to see if I can answer those questions in between also. What is medical negligence or malpractice? I'll come to this again in some of the principles, but lack of reasonable care and skill or willful negligence on the part of the healthcare professional in the treatment of a patient. Now, what are the essential elements of negligence? One, doctor had a duty. Now, if you see some patient having a problem in the middle of the street and you do not help the patient being a doctor, there is no negligence because you don't have a duty towards that patient. Your duty is towards a patient who's admitted in your hospital or who comes to see you, who comes to you in the OPD or comes to you in the IPD. So you have to have a duty towards the defendant. Second is breach of duty by the defendant or the doctor. That means you did not perform your duty. The patient came to your hospital, you did not go and see the patient. So that is breach of duty. You saw the patient, you did not take an appropriate history, do an appropriate examination, or do the necessary investigation. That is breach of duty. There is a loss suffered by the complainant. Now, if there is no loss suffered by the complainant, this is not negligence. Now, you did not examine the patient properly, but the patient did not suffer a loss. Patient became well, patient went home in a day, and there was no extra money that he had to spend. So there is no negligence from the Consumer Protection Act point of view. So there has to be a loss which is suffered by the complainant. And lastly, defendant's conduct was proximate or direct cause of the loss. Now that loss was directly because of the breach of duty. Now, giving an example, the ophthalmologist operated on an eye. The patient lost the vision. Because of the loss of vision, patient had an accident. Now, whatever the loss is because of the accident is not the doctor's problem. Doctor's problem is patient lost the vision. And if that can be proven that there was a breach of duty and that is why there is a loss of vision, then that is what the doctor has to pay for, not the loss due to the accident secondary to the loss of vision. So a direct cause of the loss. Defendant's conduct was the proximate or the direct cause of the loss. Now, question is, who will certify that complaint filed by consumer is negligent? Obviously, the consumer court. It is none of our business. They will say it is negligence, and we will say it is not negligence. And the court is there to decide whether it was negligence or not negligence. Also realize that being a neonatologist is very risky as compared to some of the other things in medical profession. Remember, courts and judges tend to treat babies with enormous sympathy. If someone loses a baby, then there could be, you can never be harsh to the parents. Even we are never harsh to the parents, but judges are also never harsh to the parents. It would be a very, let me say, who follows the letter of the law, not the spirit of the law, who would go against the parents. So the spirit is always with the people who've lost their babies or who have had their babies injured for any reason. Also remember that anything that happens to babies can lead to long-term injuries because it may not be short. It could be long-term. You have a gangrene of a finger, lost a finger. You have a brain injury. You are CP for life. Thirdly, neonates are at the beginning of their lives. Now, if someone has gone through the methodology of calculating the costs, it depends on the number of years which are there in front of you. So someone who's dying at the age of 80 due to negligence has very little time left and the cost would be less. Neonates being at the beginning of their lives, their lifetime costs can run into millions. And there is no limit as of now in India on the amount of compensation that can be awarded. Realize due to this very sympathy, sometimes even if there is no negligence, the judges tend to award in favor of parents just because you have a insurance, indemnity insurance, which they believe the insurance company is going to pay and the doctor. But we need to fight against that because that itself says that there was some degree of negligence, and we should not just say, okay, fine, the insurance company is paying, so we don't need to really bother about it and let the judgment go against us. Because for forums like National Commission, that sets a precedence. That sets a precedence for other judgments to be made by lower courts. We need to understand some of the judicial principles also. This is in common law, not necessarily consumer protect. The discovery rule. Now there is a limitation act. Limitation means that you can file a case only till a particular time. In Consumer Protection Act, that is around 2 years. So if something has happened today, the person has a right to file a case in the Consumer Protection Act only till 2 years. And after that, you cannot file a case unless this discovery rule applies or there is some other reason he can put forward to the court why he did not file a case earlier. The discovery rule creates an exception so that the statute or the law of limitation does not apply until the patient discovers the injuries resulting from alleged negligence. I don't know how many people follow the law. Recently, there was this case of meningomyelocele in UK. The child, on attaining majority, filed a case against the doctors who treated her mother, saying that she was not counseled properly regarding the problems the child could face, or she would not have continued with pregnancy, and won that case. So, for that person, and that is the law in that country, that person, he discovered after becoming a major that this is the problem, and the case was accepted. This is yet to be tested in India, but I believe the courts in India are not going to do any differently. This is restitutio in integrum. That means a person is entitled to damages, which should, as nearly as possible, get that sum of money, which would put him in the same position as he would have been if he had not sustained the wrong. Almost self-explanatory that you get that much money as if you had not been injured. So if you are earning, the person was earning 1 CR a year, you pay compensation which is higher. And if the person was earning 10,000 rupees a month, you pay a lesser compensation. Res ipsa loquitur. This is a common law thing that there is no need to prove certain things. Suppose in a surgery, a sponge is left in abdominal cavity. So this is negligence. There is no need to prove anything more than that. It is up to the doctor now to say, to defend it, but it is almost indefensible. And respondent superior, I'll spend some time. Let the master answer. This is that for any act of the junior, the senior is responsible as long as the patient is admitted under. Now, I have gone through it and I'll just spend a word. Suppose, and this happens in many corporate hospitals, that you are the only so-called consultant neonatology or even consultant neonatology and pediatrics. You want to go on a leave. So you go on a leave. You are not paid for the period you are on leave. But if something happens to the patient, you are responsible for it. Unless you tell the administration and the patient that I am going on leave and I'll not be responsible for anything that happens. Or the other thing is, if I am responsible, then let me be paid and I could take care of the things on phone. Then you are responsible for it. So never let this happen that, yes, I had an argument with one of my bosses that a patient comes to the emergency in the middle of the night at 1 a.m. The senior resident calls me, this is the patient. I say, okay, do this. I am not paid for it, but tomorrow the patient files a case because the file is in my name. I am responsible for it. So if I'm not paid for it, I will not be answerable for it. That we need to tell the people in the corporate hospitals. Now, another principle, which has been the guiding principle regarding negligence world over, although this is changing these days, I'll not say this is the principle that is being followed across the world, but India still, sorry, in India still, this is the standard principle that is being followed, that we are expected to bring a reasonable degree of skill and knowledge and a reasonable degree of care. Neither the very highest nor the very low degree of care. This is what the law requires, which a normal practitioner would do. Now, a patient has respiratory distress, is desaturating. Now, putting him on oxygen is a basic thing that every person will do. And if you don't do that, perhaps you are guilty of negligence. Now, if you are, now again, I'll bring in the concept of specialist. If you say you are a pediatrician, perhaps the court expects you to decide on whether the child needs something more than oxygen, maybe a non-invasive or invasive ventilation. Whereas if you claim to be a neonatologist, court would expect you to provide the highest degree of care. So once you decide for yourself that I want to call myself a neonatologist, also realizes that you put yourself at a higher pedestal and to a higher scrutiny levels. Whereas if you are you say pediatrician, you place yourself at a lower level with lower scrutiny levels. Now, coming to common issues which affect a neonatologist, it could be delivery room management or resuscitation. It could be a CP or a HIV, which happens in the baby. It could be line complications. It could be delays in diagnosis, especially true for something like even jaundice, as simple as that. And failure to adequately monitor hypoglycemia, and most obstetric setups would not monitor for hypoglycemia. And once you land up with seizures, then the responsibility is with the treating pediatrician or the neonatologist. Coming to some of the case scenarios. Now, these case scenarios are taken from actual cases. I'm not putting in actual cases. I'll perhaps put in one slide of that. But remember, a 26 weeks baby is born in your hospital and dies of prematurity. And you are accused of lack of facilities to handle such a small baby, citing international guidelines. Now, how to safeguard such a situation? Remember, we need to have data, competence. of past experience and data. If you handle maybe 20, 26 weeker babies in your hospital, and you can say that, okay, 15 of them have survived, and this is what I gave them a 75% chance of survival, perhaps you would get away with it. But if it is the first 26 weeker baby in your 10 years of practice you are handling, and you did not tell the parents that I am not, we have not handled 26 weekers in our hospital, and you are free to take the child to another hospital, you are asking for trouble. Then obviously accreditation and does help. You have a professional body accreditation saying that you have all the facilities to handle a 26 weeker would help in a court of law. I'm not saying it would necessarily absolve you of all the responsibilities, but it would help. Similarly, NABH accreditation for some of the common things that are there. A fire in the hospital, you have an NABH accreditation plus a fire certification, you are more or less safe. Another important thing, which I believe the courts don't tend to understand, is complications, more so in India rather than abroad. The reason being perhaps the lack of cases on the medical field, and lack of the doctors not being too proactive in presenting their cases. A low birth weight baby getting admitted to a NICU and dying of sepsis. Once you put in a late onset sepsis or a hospital acquired infection or a healthcare associated infection as a diagnosis, you are putting yourself right up front for some action on the part of the parents. Although we know that some of the ELBW babies, the incidence of HAIs could be as high as 30% or even more than that. But how do we prevent such accusations? I'll go through the actual case. National Commission held a hospital liable for a patient who developed the infection while hospitalized, saying that patient doesn't have to prove that the infection was caused because of negligence of the doctors. It is the doctors who have to prove that there was no negligence in causing a healthcare associated infection. Same thing happened with a small baby in a hospital in Delhi. Now, consent may help, but consent is not the only thing that is going to help. We also need to have data of how a good housekeeping practices of the total infections that happen in our intensive care units, and that data compared to the international or the national data could help you save. So having data is a very important thing in your defense, and having national and international data to compare with is important that way. So if all babies in our hospital are getting infection, or all babies are getting antibiotics, then difficult to defend. But yes, if our late onset sepsis rates are comparable to the rest of the country and rest of the world, perhaps an expert from PGI or AIMS would also testify to that fact. Also, I want to bring in this point that expert opinion is sought by the consumer commissions, but that is not necessarily the final word. So the expert opinion can be overruled and has been overruled many a times, because courts believe that doctors tend to favor their own community, and that is why not always is the expert opinion taken into account while delivering a verdict. Again, guidelines do help. So that is why that is where the role of the IAPNEOCHAP or National Neonatology Forum in making those guidelines. Remember, the guidelines are whatever is national guideline, and these days the ICMR and some of the other bodies are coming with national guidelines. We need to at least go through them. That is the bare minimum standards that we need to follow. We just cannot say that, yes, this is under the national guidelines. Those are bare minimum. If the patient is paying for something, then the patient perhaps expects more than bare minimum national guidelines. So that is a problem. Which guideline to follow? I commonly ask for I commonly give the example for maybe newborn screening or the quad screening, the aneuploidy screening in pregnant ladies. Now, the government is not offering that. Most of the government hospitals are not offering that. But then once a patient is coming to us who are being paid and really paid handsomely, we need to offer that to the parents. The choice then becomes theirs whether to follow that or not. We cannot force them to go through this. But see that this case of congenital hypothyroidism. Now I've seen a case of let's say trisomy 21. The patient came to me that yes, my baby has trisomy 21. Why did my obstetrician not order a quad screen? I was at loss of words to really explain that. But the only thing that I told them is that you have been looking for it now. You could have done this homework of looking at the literature once you were pregnant or before becoming pregnant, that what tests are essential. But then, yes, you could still be in trouble by not following the guidelines. Then comes the question of consent. It is the most important part in this, and perhaps Supreme Court has also really talked a lot about consent. And one of the milestone cases were where they said that you cannot perform a procedure on a patient without the consent unless the procedure is life-saving. This could be something like doing a incidental appendectomy or doing a tubal ligation during surgeries. So whatever is life-saving, you are entitled to do. But whatever is not life-saving, and remember, Supreme Court said you were told to remove the uterus, you removed the tubes. If you found that the tubes needed to be removed, or you felt that the ovaries were not healthy, close the patient, take a consent, do a second surgery, but you cannot do a surgery at that time as long as it is not immediately lethal to the patient. Now, informed consent. Now, in India, informed consent means patient has been informed about the consent. This is the most the contentious part during any litigation, that we were not told anything. Remember, the information has to be comprehensible. It has to be in non-medical terms and preferentially in local language. And what we need to cover is the diagnosis, the treatment, the risks, the prospects of success, prognosis if procedure is not done, and alternative methods of treatment. This is informed consent. I'll also say, add to it, the cost of treatment. In our hospital, what we do is an audiovisual recording for all high-risk babies. We tell the patient what the problem is, how much time it is going to take for the child to get better, what are the chances of survival, what all procedures may need to be done on the patient, and what is the approximate cost of treatment. We do it in the local language, we record it. Realize that you can get a signed consent, but if the patient is not literate, then that becomes a problem. Even for literate patients usually the defense is, डॉक्टर साहब ने कागज दिया था, उस पर हमने साइन कर दिया, हमने तो पढ़ा ही नहीं लिखा क्या हुआ था उसके. Now, that is why an audio-visual consent in a very high-risk case is better than a written consent. So you need a consent before you do anything. So even if you are resuscitating a patient in the middle of the road, perhaps the court will exempt you, but then still, this is the cartoon. Coming to lack of facilities in a hospital. Remember that no hospital is going to have all the facilities, but we need to tell the patient what we have, what we don't have, about some of the basic things. Like if I have a level 3 neonatal ICU, but I don't have cardiac surgery, and tomorrow a baby um, with a congenital heart disease which requires immediate treatment is born in our hospital, patient can say, you didn't tell me before, or I don't have therapeutic hypothermia, or INO. Now, the important thing is, one, we don't exaggerate the facilities that are available in the hospital. We document what is provided, and we refer early if we don't have the facilities. This was then a milestone case again, where a mother with, I believe, preeclampsia continued to stay in a hospital for more than 2 weeks. And after delivery by a cesarean section, the babies were referred to another hospital. The patients filed a case that if you did not have facilities to handle these preterm babies, why did you keep the mother in the hospital for 2 weeks? And secondly, um, then referred, we could have and did the section there. This happens every day in our practice. I think sooner than later, and that is why I said many times there is negligence and the parents don't sue you for that. This happens in most places where small babies are picked up from peripheral hospitals to be transferred to tertiary NICUs rather than being delivered in centers where they can be cared for. And we know from literature that even the best of circumstances in the Western world, delivery in a tertiary care institution is the predictor of survival for very small babies. Now, I'll go through one of the cases which the Supreme Court, on an appeal from the National Commission, looked at certain things and in how much detail do they look at. This was a case regarding ROP. Remember, ROP is the Waterloo for neonatologists. Uh, and most of the litigation where compensation has been awarded is on retinopathy of prematurity screening or lack of it, let me say. Uh, um, on examination of the records, the entry is not recorded in the same sequence. The date is mentioned in a different column. The time of the ophthalmological examination, or to just give you the background of the case, perhaps the ROP screening was not done. And subsequently, once the child developed the ROP, they asked for the records. The records were fudged. The ophthalmologist put in an entry in whatever space was available. And then these are the observations of the court. The treatment sheet do not mention dilatation of the pupil. So it is very important that if you're doing an ROP, you put in that, yes, these drops are put in the baby's eyes. There is an order for that. And that order has been carried out is also mentioned in that, because there is a correlation of the findings. Or if the patient goes out of the NICU for a surgery, that is mentioned, the patient shifted to OT for laser surgery or for any procedure. Now, coming to preventing litigation, what are the important things in preventing litigation? Maintain competence. As I said, yes, you need to keep refreshing yourselves by attending CMEs, conferences, webinars, by studying yourself. You cannot practice what was practiced 20 years ago and say, I learned it that way. Communication. Remember to communicate with team members so that everyone communicates the same thing to the parents. The problem happens that the nurses say something different, the junior doctor says something different, and the senior doctor says something different. Once you're clear what needs to be communicated to the parents, then you communicate with the parents. What saves you in a court of law is documentation. Detailed and timely documentations. And I still go to many hospitals and see not a file is made of any admission. Leave aside the documentation. Communication, documentation, and documentation of communication are important things. Have a referral center ready so that if you think that the child is becoming sick and your hospital cannot handle it, have a liaison with the referral center. Do not shy away from cross consultations wherever required. So do not administer anesthesia yourself, even if you are competent to do so. Ask for an anesthetist. Pay him the requisite money. If you are doing a minor suturing, ask for a surgeon to do that rather than do it yourself. So these are the things which help. Lastly, be aware of the law. Ignorance of law is no defense in law. That's the basic principle of law. That I did not know the law is not a defense. So you need to know the law to prevent litigation. Other important points. have a professional indemnity. I would recommend, as a neonatologist, your minimal professional indemnity should be at least 1 CR for all individual doctors. That is the amount. And we could have an entire session on how to determine the professional indemnity and which professional indemnity is better than the others. But it should cover, for one case, at least 1 CR. Now, some insurance companies offer a ratio of 4:1. Remember, it has to be always a ratio of 1:1 when you buy a professional indemnity. You have a good rapport with doctors and media in your town, so that things don't go out of hand. If there is a case filed against you, don't worry. If you're doing some work, if you don't have any case against you, perhaps you're not doing enough work. Very simple. Interact with your lawyer, talk to him, what is your point of view, and attend every hearing. Remember, lawyers are almost as competent or worse than doctors, and they don't know anything about the medicine. So every time a question arises in a court of law, if you are there, you can answer it more rationally than your lawyer. And then relax. A Consumer Protection Act, at the most, you will be saddled with the compensation. And if you have an indemnity, rarely does the court give compensation in excess of your indemnity insurance. So it's okay, fine. So you're not losing anything. I'm ready to take questions. Okay, I'll take this. Good evening, sir. What if private NICU doesn't have therapeutic hypothermia or INO? If you are refers to a higher facility with facility, but parents don't wish for transport due to transport or money issue, in such conditions, you can always, because therapeutic hypothermia or INO is not necessarily going to save the baby. You can say the chance of survival with this is slightly better. But if you don't want to say, document it and get it signed on on a piece of paper or on your file, and that is important. Which company indemnity insurance? I do not recommend any company. You can find out any company and which provides good services in your area, because it could be variable for different areas. So find out one which provides good services from your fellow colleagues, and if that is fine. But remember, the companies have lawyers on board. They are being not paid separately for your case. So sometimes it would be wise to especially those which not only provide indemnity but also provide legal services along with it. So it is better to really attend the case, read the replies made by the lawyer yourself, each line of it, and then sign on it, rather than just say the lawyer must be doing his job perfectly. No, the lawyers do not do their job perfectly, just like doctors don't do their job perfectly. So you can put chest tube for pneumothorax, or have to wait for the surgeon. No, you can put chest tube. It is an emergency. So as I said, in emergency, any life-saving procedure you can always do. No, you are entitled to a copy of the complaint, and you can give it in writing that please give me a copy of the complaint by the person concerned, and that is it. As I said, I'm not today dealing with criminal law, but then remember, it is your right under the law to get a copy of the complaint, and it is just a way of putting pressure on the doctors to compromise by not giving them a copy of the complaint. So you need to find ways to resist that pressure and ask for a copy of the complaint. Yes, I'm not saying that sometimes you know that you are at fault. So there it is always better to really compromise early and and get out of the difficult situation rather than trying to put up a brave front when we know that we are not right. Because by compromise you only lose money. By not compromising, you take the stress till the case is disposed of. I would not like doctors to be under stress for long periods.